Bismillahirrahmanirrahim. We discussed about the bone disease, osteoporosis. Today we will discuss about the disease that is caused by osteoclast dysfunction, that is Paget's disease, also known as osteitis deformans. So there are three phases of this disease, Paget's disease. Phase 1 is increased osteoclast resorption, that is osteolytic phase. Stage 2 is increased bone formation, osteoblastic phase, and third is osteosclerotic phase. In this disease, there is elevated alkaline phosphatase and elevated urine hydroxyproline. So Paget's disease may be monostotic, that is affecting one bone. 85% cases they are monostotic, and 15% they are polyostotic, affecting multiple bones, skull and pelvis. And there is a jigsaw puzzle-like deformity or arrangement. There are prominent cement lines connecting the disordered, unsound bone trabeculae. Prominent cement lines connecting the trabeculae. So here you can see the different phases of Paget's disease. First is osteolytic phase, in which there is increased osteoclastic activity. Multiple osteoclasts resorbing the bone. Then is the mixed phase, osteoblastic and osteoclastic. So there is resorption as well as new bone formation. And the third phase is osteosclerotic phase, which show a rim of osteoblasts on the periphery of the formed bone. So clinically, these patients, they present with pain in the affected bone. There may be microfractures. So pathogenesis of Paget's disease, there are mutations in the SQSTM1 gene, and 40 to 50% of the Paget's disease, they are familial. Then mutations in rank L and rank OPG genes. 5 to 10% cases, they are without a family history. SQSTM mutations, they enhance the activity of NFK beta activation by rank signaling, leading to increased osteoclast activity and increased susceptibility to the disease process. So this shows increased osteoclastic activity. So this is the mosaic pattern of the sclerotic bone, and there are prominent cement lines connecting the sclerotic bone. So this Paget's disease is a condition of increased but disordered and structurally unsound bone. So this X-ray shows bowing of the anterior leg. Morphology: bone is larger than normal, but coarsely thickened trabeculae and cartilage that are soft and porous. These bones, they lack structural stability. They are vulnerable to deformation under stress and bone fractures very easily. Most of the cases, they involve the axial skeleton or proximal femur. Pain is localized to the affected bone. Now, what are the tumors or tumor-like lesions which can develop in a pagetic bone? Benign lesions like giant cell tumor, giant cell reparative granuloma, or sometimes extraosseous masses of hematopoiesis. And tumor which can arise in Paget's disease of the bone is osteosarcoma, or sometimes fibrosarcoma. On X-rays, you see thick, coarsened cortices and cancerous bone. So tumors is giant cell tumor and osteosarcoma. They are the most common tumors developing in Paget disease of the bones. So that is about the Paget's disease. Then we go on to osteomyelitis, that is inflammation of the bones. Osteomyelitis may be pyogenic, or it may be mycobacterial, or sometimes it may be spirochetal due to syphilitic microorganism. Pyogenic osteomyelitis is in 80% of the cases it is caused by bacteria Staphylococcus aureus, gram-positive coccus, and gram-negative bacilli, Escherichia coli, Pseudomonas, and Klebsiella. And the route of transmission or dissemination is through blood, metagenous spread, or from contiguous organs suffering from the mycobacterial or pyogenic infection, or sometimes direct implantation when there is an injury to the skin and there are fractures, then direct implantation of Staph aureus or other bacteria may occur. So this is the X-rays and bone scan showing osteomyelitis. So diagnosis of any bone disease requires X-rays, bone scan, MRI, then histopathology. On microscopy, in pyogenic osteomyelitis, we see numerous neutrophils infiltrating the bones, and there are areas of necrotic tissue debris. And once the bone is necrotic, we call it as sequestrum. So dead bone is called sequestrum. And acute inflammation, necrosis of bone, bacteria and inflammatory lesions spread in soft, shaft, and then periosteum, and then subperiosteal abscess formation. And there is segmental bone necrosis. So dead bone is called sequestrum, and this leads to rupture of the periosteum, and then there may be formation of skin sinuses, draining sinuses. So after first week of acute infection, then there is chronic osteomyelitis, that is chronic inflammatory cells. They secrete cytokines, and then there is resorption of bone by osteoclasts, and bone fibrous tissue formation, and in the periphery there is reactive bone formation. And newly deposited bone forms a sleeve of living tissue around the segment of devitalized infected bone, and that is called involucrum. Involucrum is the newly deposited bone around the devitalized infected bone. So what are the complications of osteomyelitis? There may be subperiosteal abscess formation, draining sinus formation. Infection may spread to the adjacent joint, which may lead to septic or suppurative arthritis. And bone may be fractured, that is pathologic fracture. Secondary amyloidosis or infection may spread to involve the valves of the heart, that is endocarditis. And rarely squamous cell carcinoma and sarcoma may develop in the infected bone. So Brodie's abscess, it is intraosseous abscess which involves cortex, and that is walled by reactive bone, that is called Brodie's abscess. And sclerosing osteomyelitis of Gare, there is extensive jaw, new bone formation. So clinical features of osteomyelitis: acute osteomyelitis, there will be acute symptoms, that is fever, malaise, chills, and peripheral blood will show leukocytosis. And there is a lytic focus of bone destruction surrounded by a zone of sclerosis. Diagnosis is made on biopsy of the affected bone and bone cultures. Antibiotics and surgical drainage, they are the treatments. So tuberculous osteomyelitis usually is blood-borne, and tuberculosis of spine is known as Pott's disease. It breaks through the intervertebral discs, lead to abscess formation. And syphilis may sometimes involve the bones, and it is often congenital. So tertiary syphilis, it involves the shin bone, and there is massive reactive periosteal bone formation. So this is Pott's disease of the spine. So there is kyphoscoliosis, collapse of the affected vertebra, which may result in various types of deformities. So that is about the Paget's disease and osteomyelitis.